Well, Scott's Nation, we're joined by Dr. Benjamin England from Blunt Memorial Hospital. He's going to talk to our student athletes today about concussions. Dr. England, just a broad-based question. What is a concussion?
That's a good question. So, a concussion is basically a functional change in the brain that occurs after some level of trauma. So, uh, immediately after a head injury, like an impact to the head, which is the most common, but can be a rotational force or a sudden change in speed. Uh, there are some chemical changes that happen in the brain immediately that just make it not function quite so well and make it a little bit more prone to injury.
What are the common and uncommon signs and symptoms of a concussion?
Okay. So the most common probably is headache, but confusion, dizziness, loss of a little bit of memory either before or after the actual event, or both. Um, Most patients they feel kind of like they're in a fog where they're not real clear on what's happening, or things just feel a little bit slower around them. Nausea, vomiting are not too uncommon.
What should our student athletes do if they think they have a concussion?
The important thing to do is to remove yourself from any risky situation, be it a practice or a competition of some sort, or anything where you could get further injured. And then you really need to immediately talk to either the athletic trainer or the coach or any medical personnel.
Can you explain to our student athletes what is baseline testing?
Yeah. So baseline testing is done a couple of different ways, but it's usually some sort of neurologic test that we can do um, for at-risk athletes like our contact sports, to know what their normal level is of neurologic activity, be it their balance or reaction time, things like that, so that when someone has a concussion, we can go back to look at those results and compare and see where they're having a problem and how bad of a problem really is it.
You hear in the media sometimes that student athletes are in concussion protocol. What does that exactly mean?
Okay, so concussion protocol is really initiated once someone has been identified as having a concussion. There's a specific way we treat that, and there's change in the way they are allowed to do physical activity, sometimes change in their classroom activity, and also what specialists they may need to see and how they're evaluated. Also determines when they need to report to the athletic trainer, what symptoms they need to report, and then also what neurologic symptoms and testing they need to have done.
If they're addressed into that protocol, what are their limitations and restrictions?
Okay, so once the protocol is started, it's a little bit specific per person, but there are some general guidelines that you're immediately removed from any contact sport where you could have another injury. You are allowed to do a certain amount of low-level physical activity early on, and you're gradually progressed through levels of exertion and levels of complexity until you're back to your sport. So it changes a little bit day by day.
Every student athlete is going to ask, when can I return to play?
That's a good question. So returning to play is really the final step of the protocol. And that's the final step is really a full contact practice and then full contact game. So that is typically within 2 to 3 weeks for most injuries, but it can vary quite a bit from person to person. It can last months. Sometimes people don't even return the same season. Um, it varies a little bit based on how many concussions they've had in the past, how severe their symptoms are, if they have other neurologic diseases and things like that.
When they're in the return to play protocol, what is a return to learn?
So returning to learn is when you can start school activity, either in the actual classroom or homework at home or any other type of mental stress. So again, that varies a little bit from person to person. And we know that you can return to those activities a little quicker than you can return to physical activities. Sometimes returning to studying and listening to a professor, that can make your symptoms a little bit worse, but we know those activities are not going to prolong your symptoms or make the recovery longer. Um, Now, sometimes we have to change things such as how much time do you spend actually staring at a computer screen, because that can be more irritating, or do you need help taking notes in class? So those things can be changed kind of based on what your classes are and what seems to be bothering you the most.
Well, most student athletes want to get out on the field or playing venue as
Mhm.
quickly as possible. What are the consequences of playing through concussion syndrome symptoms?
Okay. So uh, that's one of the reasons we do have the protocols. We do want you to be fully recovered from the concussion before we put you at risk for further injury. That being, if you have a second injury before your brain's really ready and recovered, you can have much worse symptoms. They can last a lot longer, and in some cases, they can be permanent. And in some cases, we call that post-concussion syndrome. It's a little bit of a broad term, but that's where you do have some symptoms long-term that are a little bit more difficult to control, and in some cases are permanent. In some cases, there's also the risk of what's called second impact syndrome. Now, that's um, a very incredibly rare situation and a little bit controversial, but that's when someone has an injury to the brain when the brain is still very sensitive and more prone to getting injured further. And that's where the brain typically swells and can have some severe neurologic consequences and sometimes even death.
Well, let's walk us through a concussion scenario. You have a football player that is trying to tackle an opponent. Um, Talk a little bit about the scenario going through baseline testing all the way through the return to play, how you would progress a student athlete.
Okay. In that particular case, a football player would normally we would ideally have baseline testing on them. If they have it from high school, we usually repeat it by the time they're in college because it needs to be repeated at least every 2 years, preferably every year at the beginning of the season. Uh, so going into the season with that baseline is very helpful, and that's a good start. If they are identified as having a concussion during a game, it's either identified by the way they're acting or by what's happened on the field by a coach or an athletic trainer, or sometimes the patient notes the symptoms and come directly to the staff, which is great. Once that happens, they're of course removed from that situation and they're assessed immediately on the sideline. And that immediate assessment is one to make sure they don't need emergency treatment. You know, do they have concerning findings enough that they need to go straight to the hospital? If that's the case, they're usually sent by ambulance straight over. Assuming they don't need that level of care, they're pulled from that situation. Given a thorough testing, there's a certain amount of neurologic testing we can do on the sideline and compare. Um, in some situations, when a patient comes and they're not entirely sure they've had a concussion, we talk to them, go through their symptoms, do an examination, and sometimes it's not a concussion, and that's we allow them to test on the sideline a little bit and maybe go back to play. In most cases, when it's a concussion, they have to be removed from that, and they're usually observed overnight, at least as far as checked in with from the athletic trainer. Sometimes we have the roommates get involved a little bit if that's possible. We don't keep them awake or wake them up every couple of hours or anything like that, but we'd like to have someone looking over them. The next day, they follow up with the athletic trainer or the physician. I usually go through some testing again at that point, kind of monitor their symptoms, see where they're, look for any red flags or any problems they're having. Usually go through some computerized neurologic testing at that point. And again, compare what's normal to them and get an idea of, are we looking at a more severe long concussion versus something more maybe short and maybe a little bit more predictable. Um, as they recover, we increase their physical activity. At first, they're allowed to do very light activity, sometimes some stationary bike, brisk walking, even light jogging if they're doing well. And then when they're feeling really close to their normal and their testing looks pretty good, we increase their activity day to day, starting with some exertion and sprinting and then weightlifting, and then more complicated sport-specific scenarios, such as in football, like this player, you would have them do drills and things like that. Not necessarily risky full contact drills, but something where their brain has to stress and think about what's going on around them. If that goes well, they go into the next phase and they actually do a full contact practice. If that goes well, of course, they go into play. If any point in that protocol or that time frame, if they start to have symptoms come back, then they take some time off and kind of start the process over a little bit. We call that washing out, which does happen occasionally when someone thinks they're a little bit better than they really are. And that's why we take that step-by-step progress to make sure they're really, really ready to be out there back on the field.
We appreciate all your insight and input into concussions, and hopefully our student
Mm-hmm.
athletes will remain healthy throughout their career. Do you have any final thoughts about concussions and maybe the services that Baldwin Memorial Hospital and yourself provide for our community?
Well, as far as concussion, I want to make sure it's real clear as far as the student athlete that it's a very, very normal thing to come to the athletic trainers for. It's nothing to be ashamed of. No one's going to be mad at you for this. It's not something that you can really be in full control of. Um, uh, Over here at Blunt Memorial, we work very closely with the athletic training staff and hopefully coordinate all the care we can very closely and be there for everything you guys need. And of course, I'm here all the time. And Dr. Groth is also one of the team physicians who's very skilled with concussions as well. And we look forward to working with you again.
Well, on behalf of Maryville College, we want to thank you for your service to our community and our institution, and just thanks for everything that you do.